A woman from Moray whose liver cancer was misdiagnosed as gallstones is campaigning for earlier testing for people with symptoms. Nikki Simpson had to wait 6 months for a scan despite repeated GP visits. Now she's helping a national campaign to make more people aware of the signs. Nicola McCally reports.
Nikki Simpson uses social media to spread the word about liver cancer. It took months of GP visits and a 6-month wait for a scan before she was given her diagnosis of cholangiocarcinoma. The Murray mum's now had 15 rounds of chemotherapy and is undergoing immunotherapy.
I was told because I'm a wee bit overweight that it was probably gallstones. Went back to the doctor several times with pain and waited 6 months for a scan, unfortunately. Once the scan was done, I was diagnosed with cholangiocarcinoma and I had a 10 centimetre tumour on my liver.
Once classed as rare, cholangiocarcinoma is now on the rise amongst younger people, with 6 in 100,000 Scots developing the disease. Vague symptoms such as pain under the right rib, tiredness, pale stools and dark urine mean it's difficult to diagnose and often not until it's too late for treatment. Liver cancer charity AMMF says it wants more GPs to be aware of the signs and urges people who are concerned to ask their doctor for a liver function test.
We ask GPs just to be aware that these vague symptoms could add up to something serious. And if there's the slightest suspicion, run a liver function test. It's just a blood test, and it will show if there's something, some of the liver results, if they show raised or in any way suspicious, then start investigating.
A recent reception was held at Holyrood to press politicians to fund more research into treatment for cholangiocarcinoma. Public Health Minister Jenny Mintos agreed to consider the case for tests which explore if patients are eligible for immunotherapy treatments, which can delay the cancer's progress. Back in Murray, the Simpsons say they don't want anyone else to have to suffer life-changing delays for a diagnosis.
If we can help someone else going forward, I mean, it's difficult for us and the people we met at Holyrood at the weekend, but if we can help anyone else that's going to be in our position, then that can only be a good thing.
Yep.
So yeah, it's a positive.
Raise awareness, stop this from happening to other families.
Nicola McCally, STV News.